Hello everyone, welcome to Sunday Live Session. I am Dr. Tanema Singhal and I am a childbirth educator, pregnancy educator, Garbh Sanskar expert and a lactation consultant. I am practicing at Masi Care Clinic, Vikas Nagar, Lucknow. I do take online consultations also. I have 12 years experience in obs-gynae. My basic graduation is in Ayurveda and post-graduation in reproductive child and health. Today's topic is pregnancy week by week. Every mother wants to listen to the first sounds of her baby, the first movement, the first milestone of each and every development. From the baby's first ultrasound to the baby's first kick, what all changes a mother can expect in her baby are spoken today. The whole gestation period is divided into three trimesters. The first trimester, starting from the time of conception to the 12th week of the pregnancy. The second trimester starts from the 13th week till 28th week of the pregnancy. The third trimester starts from 29th week and goes on till the 20th week of pregnancy until the delivery occurs. So week 1 and 2, these are the time when our lady is not actually pregnant. The counting starts right from the time of your last menstrual period. Actually, it is lot difficult to pinpoint the exact time when the fertilization occurs. So the gestation period is counted right from the time the new egg is released. Week 3. This is the time when you can firmly say that you are pregnant. The zygote starts dividing and forms cluster of cells, first called the morula. The inner mass of cells gradually develop into the embryo. Week 4. This is the time when the implantation takes place. The ball of cells is now no bigger than a poppy seed. It finds its way down the fallopian tube and gets implanted in the endometrial lining. By the end of the 4th week, the foundations of the baby's organs are firmly in place. Week 5. The little ball of cells now resembles a tiny tadpole-like shape with a distinguishable head and a tail. There is also the formation of a rudimentary digestive system. Week 6, the baby's nose and mouth start forming. Week 7, the umbilical cord is formed and the limbs start forming. Week 8, growth spurts are occurring throughout the body and the limbs are growing longer. Eyelids are formed, the heart is divided into left and right chambers, the baby grows and along with it, the amniotic fluid increases too. Week 9, the tiny muscles start to form and the fetus can be detected on ultrasound. Week 10, the stomach and kidneys are operational, the heart is fully formed, the teeth starts forming in the gums, the gonads start forming too. Week 11, the bones begin to harden and the skin gradually turns from see-through transparent to opaque. Week 12, basic brain structures are complete and the brain takes up half of the weight of the body. The heartbeat becomes loud and clear. Week 13, fingernails and the downy hair on the body starts forming. Her chest muscles and vocal cords are developing slowly. Week 14, this is the start of the second trimester. The baby's posture improves. The coating of downy hairs called lanugo covers the body. The brain develops, the left and the right cerebral hemispheres. Body reflexes are established. Week 15, the baby's vertebral column starts to ossify. The urinary system is formed. Week 16, muscles are stronger, facial expressions are observed, the eyes are sensitive to light and can make small movements, thumb sucking reflexes can be developed. Week 17, the heartbeats become steady, the baby can hear the mother's voice, fat stores are starting to develop under the baby's skin, and so we do start practicing Garbh Sanskar sessions, which I take for my mothers who are pregnant. For the sessions called Garbh Sanskar can be started from week 17 onwards. Week 18, the baby's first poop meconium starts forming in his bowels. The baby's nervous system is under major construction. So that is the reason we start Garbh Sanskar sessions from this time. Week 19, you can feel the baby movements inside. The skin of the baby is covered with vernix caseosa. Week 20, external genital organs are visible. Most of the fat that is formed is brown fat, which keeps the baby warm. Week 21, taste buds develop. Week 22, the baby's finger learns to grab into different body parts. During week 21, Mothers should try eating more vegetables and fruits so that the child is a less picky eater later on. Week 23, the blood vessels develop underneath and so the baby skin takes a reddish hue. Keratin is being added to the baby's skin. This helps in thickening the skin. Specialized lung cells, pneumocytes start developing. Week 24, the baby is putting on more and more weight. The auditory system of the baby is rapidly developing. The hair on the baby's body is still white and has yet to get pigmented. Week 25, the surfactant, a chemical which helps the lungs to expand once the baby is out of the womb, is starting to form. The baby draws in amniotic fluid through the nostrils. Week 26, the eyelids open up, the baby starts blinking, the baby is becoming coordinated. Week 27, the baby is now more than a foot long, the baby ingests amniotic fluid in large quantities and excretes urine. Week 28, which is the beginning of the third trimester, the baby begins to experience REM sleep, the baby starts hiccuping. REM sleep is rapid eye movement. Week 29, the baby grows stronger. The kicks and jabs feel more strong and frequent now. Week 30, the lanugo or the peach fuzz around the baby starts shedding off since the fat keeps the baby warm. The brain develops more grooves and creases. The surface area increases. The red blood cells are produced in the bone marrow of the baby. Week 31, all the five sense organs of the babies are now operational. The baby sleeps most of the time. Week 32, the baby settles into the birthing position, head at the bottom, the legs up. Week 33, the baby gains weight at a steady rate. The sharp kicks and the jabs are more painful now. Week 34, the 1x, the coating of the skin and the baby starts thickening. The hands and the legs of the baby may be visible through the belly. Week 35, a minute. Week 34, the 1x, the coating on the skin of the baby starts thickening. The hands and the legs of the baby may be visible through the belly. Week 35, the percentage of fat in the baby's body is now 15%. The space inside your uterus is now getting more and more cramped. Week 36, the fetus looks more like an infant. In the case of first birth, the baby drops at the pelvic level at this time. This is known as lightening or dropping. Week 37, if the baby has already dropped, the bounces and the kicks become less frequent due to tight quarters. Week 38, the baby eyes are now pigmented through this, may change color once they are exposed to light. The lungs are fully mature. The baby is ready to live his life outside the womb. Week 39, the tear ducts start developing. More fat gets accumulated. Hair may grow on the head of the baby. Week 40, the baby's umbilical cord is around 20 inches long. All the baby's body organs and reflexes are now fully functional. The baby produces stress hormone, which helps the baby in accommodating with her new surroundings after birth. Mostly the partition occurs at this time. Through some pregnancies last 42 weeks also. So these are the changes which are week by week during the pregnancy. And as the trimester is completed around 37 weeks, it is safe to deliver the baby. So if the baby comes out at 37 weeks, the baby is called as term baby. And so these are the pregnancy changes week by week and the breast changes that you can experience during pregnancy. Each woman is different, so do not become afraid if your symptoms do not match with the mentioned ones. You are doing great and everything will be out on the end. Keep faith in yourself and enjoy your pregnancy. Hope you like this session. If you really like this session, kindly share this video so that more and more pregnant women are informed about what are the changes during pregnancy. Thank you so much. This is Dr. Tanima Singhal signing off. Bye-bye.